And that is the mission. Dr. Pierre is the chairman of the organization, so he will lead that effort this afternoon to provide some of the material benefits we mentioned in the memorandum of understanding. So thank you very much for welcoming us. We do appreciate your effort. Thank you.
I listen to my residents. They correct me when I make mistakes. I'm not hungry because we're in the business to learn. And this is what I want us to do. Today, our purpose of really being here is to start a new era. That is to work with Dr. Hansons, to work with Dr. Coker, Dr. Faludin, and other heads of departments to introduce basic CPR, BLS, and ACLS in taking care of patients. I think that's a good thing. It is too short. It's a limited time to come here today in 2 hours and to teach anybody to do BLS, ACLS, or CPR. But these things are very, very essential for all healthcare professionals and even those who are not in medicine, because you can save lives. So what we have decided is to create a committee with some of you so that we can come back in about 3 months, 4 months, with a team of other doctors, other nurses. I'm not leaving you behind because I get lectures from nurses too. So we can have a week of training, didactic lectures and practical. And then you can take the exam, can certify you that you can provide ACLS. But you cannot do ACLS if you don't know arrhythmias, you don't know how to read EKG, you don't know how to interpret a lot of things. So this is why we want to come and have this committee so that we can discuss things and she can teach. Any one of you who want to teach can teach. And then we have the standardized examinations which you will take. And if you pass it, you are a certified provider. I hope that will be accepted. I'll be to the point. We came here, we saw, we went and discussed things. We spoke with the minister and some other people around here I know. They told me, do it. The only thing, leave your crown at Longi when you come here. So I don't have a crown today. I'm just okay. I want you to know that in the past we have supported Connaught Hospital for several years. And we don't let people know about things, but indirectly we've done that from the time we had Ebola to COVID to the tanker disaster and things like that. We have worked closely with Dr. Kaba, we worked closely with SLMDA. Last year we were here, we donated an ultrasound machine to help with diagnosis at the intensive care unit. Today I am also going to present to you that we have decided to support the ICU, your residents, and all doctors who want to continue to learn by presenting to them up to date, which we've done in the past, mix-up, which is read, detailed by most physicians in the world, that can make you to pass any medical examination if you want to, and manage any patient effectively. We're also going to provide for you med study. That is what over 10 million physicians in the world use to treat patients who don't believe in ChatGPT or A1. They want to do real medicine. So these are going to be presented. Some of them are going to be online. I'm going to give you the password and how to get on. Use it, study. You're going to do a lot better. You're all knowledgeable, but with a little addition from what you learn from there, it's going to increase your acumen. I want to say also that we have
on this occasion, Dr. Pierre and group my distinguished colleagues and mentors and also former students, good afternoon. I think it's a special privilege for me to be here this afternoon. How many things I had to push. Here and the Diaspora group decided to give back to our continent, our country of origin, something most of us have been doing for almost 25-30 years all over sub-Saharan Africa, including Mama Salon. And Connaught is special. I mean, if you've worked in Connaught, each time you come here, you feel back at home. I'm sure I got lost in the hospital. You are waiting for me because you go from one patient to the other. So medicine is an art. It doesn't matter with the political hat you wear. I was with Dr. Let's this morning with dermatology. I want to start teaching and give you beautiful cases again. And this is something part of you. When you enter the hospital as a physician, you feel that sense of belonging. So which is why I'm happy that such initiative is taken up here. And it's normally said, how you make your bed, that's how you lie on it. So if we prepare Connaught well for handling the basic life support, it's a starting point. But the story should not end here. Because we are the Minister of Health to look at healthcare from that holistic perspective. What happens in one facility should be extrapolated or escalated all over the country. Which is why I'm happy we are having that bigger vision in line with what we do in the life-saving model. And so this is very welcoming to all of us, and I'm happy we also have been thinking about similar venture, especially Dr. Pierre can say, I travel all over the country, and at times you fear that if something happens to you, one side is Sekrango Connaught. If you are in Kabbalah, if you are in Kaila Connaught, it's way long to come. That's why we have to develop capacities along the way. We even have a thought of having trauma holding centers. I think one of the first ones we developed is at Sayama. I'm very passionate about that because accidents happen along the way. Emergencies happen in surgery or in medicine. You need to take somebody quickly. Our ambulances are just carriers. We don't have the ambulance services we need. I mean, luckily now we have somebody who's a physician head in it, so he starts managing the case. For those sitting at the referral centers, I hope Connaught Hospital have got rid of that SCCHN who's sitting there receiving all the complex cases. I hope he's gone. Because at tertiary hospital, you don't have an SCCHN. And I don't say this as a criticism. I knew I was coming to the hospital setting. Because I mean, this is what we are saying about. If he's properly trained in what we do in basic life support, he will know that when you hear the patient, there was an accident, I think it was in McKinney. The patient has rib fracture, possibly puncture the lungs, and the patient was contrast to GCS about 8 or 9, and they called him to say he's got a head injury, he's got a rib fracture, we don't know whether the lung is punctured, and they said, okay, no, it's waiting tomorrow morning. I think that boy, he had me and that guy. I cannot imagine that. Which means this sort of things will have happened as early as yesterday. If he knows what it is to have a lung fracture, to have pneumothorax, to have somebody with a decreased level of consciousness, and say, we'll get the patient tomorrow. I said, what happened that night? And the patient was brought that night. I think she had elite complications. She was flown to Ghana. Well, because when you are a physician, no matter, they call me techno-politician, fine. You can see technically wherever I see, but you think about that.